A good planning of the test is the best start you can have. 2 experienced audiologists are available and a suitable and well-equipped room is free. It's not a good idea to start the test in less than optimal conditions. The child may get confused and the auditory attention may be too poor once the real test can start. Also, in older children with poor attention, it is better to test with 2 audiologists.
Lukt dat voor jullie op een woensdag voormiddag? Ja, dat is voor ons het gemakkelijkste, omdat we dan extra audiologen hebben aanwezig om kleine kindjes te testen. Ja, dat is goed. Ik zal eens even kijken.
The room must be attractive and tidy. Too many toys and other distracting things are to be avoided. For hyperactive children and children with an attention deficit, it's better to keep the room as empty as possible. A cupboard where all the toys can be put away is practical. Age-appropriate furniture is used and everything should be ready before the child enters. It is then clear for the parents to see where they should sit. It's important to address the child first and then the parents. To have good eye contact with the child, sometimes it's necessary to squat down.
Is dat Florianneke? Ja. Iman. Florian. Oeps. Een beetje boeken scheuren.
Ja, weet je.
Mag komen luisteren.
Ja, weet je luisteren?
Kom, een beetje luisteren. Kom. Hé? Kom zo. Ja, goed zo. Kom.
Kom maar mee, hè.
Is het langs hier, mevrouw?
Kom, Florian. Florian, kom.
Preferably, the child isn't sitting on the lap but in a high chair or on a small-sized chair.
Kijk, en nu gaan we wachten, hè. Emily, zo. Ja. Oh. Zzz. En een beetje omhoog.
Nee, we gaan niet spelen. We gaan alleen maar zo zitten.
Elena is taken on her mother's lap because she feels uncomfortable.
Ik denk dat is goed. Kun je dat een keer doen? Zo, ja. Oké, voilà.
When children are too small to sit comfortably in a high chair, they have to be taken on the lap so that their upper body is steady. The position of the child must allow the child to show head turns easily. A 1-room as well as a 2-room test setup can be used. Especially for the young ones, we like to use a 2-room setup with 2 testers. 1 tester serves as distractor or test assistant and is sitting in the sound-treated room close to the child. The other one acts as stimulator and is sitting outside the room. The major task of the distractor is to keep the child focused at the midline and to stimulate the child to pay attention. The tester or stimulator decides when to present a sound and observes the response behaviour of the child. Stimulator and distractor must be able to share their impressions with each other. To enable the stimulator to hear what is happening inside, the microphone is put close to the distractor and its function is checked before the test starts.
Rood. Klaar, we gaan beginnen. Nog eens? Ik zet mij. Rood. Hoort je mij, Christine? Ja. Allez, mets ton casquette comme ça.
Beaucoup de
Voilà,
plaisir,
ça,
hein,
c'est
Carina?
Merci.
Voilà. Allez, amuse-toi.
Déjà, je vous remercie, oui. Déjà, vous savez déjà à l'avance que... Oui.